All small businesses with 50 full-time equivalents of employees must comply with the ACA. So therefore, when we're talking about full-time equivalents, we're talking about employees that work 30 hours per week or more is now defined as full-time. You have to count equivalents also to determine whether or not you're a 50-plus employer. And that you have to add up all your part-time employees and compile those hours to see how many of those part-time employees make a full-time employee to determine if you're a 50-plus employer. If you're a sole proprietor, you're treated by the Affordable Care Act as an individual, and you do have to have insurance, and you can get it either through the open marketplace, through your insurance agent, or go to the exchange through healthcare.gov. If you're a business owner with fewer than 50 full-time equivalent employees, you have never been required to have insurance for your employees, and you still aren't required to have insurance for your employees, but the reasons to have insurance for your employees are still the same as they've always been. You want to be able to obtain quality employees and retain quality employees. So make use of all of the tools that have been available to you in the past and are still available to you now through licensed insurance agents, business associations, and your local chambers. There are several ways to obtain insurance for individuals and for groups, and that can be done through healthcare.gov, and you can only get a tax subsidy for your insurance if you're a small employer of fewer than 25 full-time employees and your employees make less than $50,000 a year, and you must get that policy through the SHOP, which is the federal marketplace for small business insurance plans. Your agent can help you determine whether or not you would be eligible for that subsidy and whether or not your business will be eligible for the subsidy based on its size. Subsidies for health insurance through the exchange are available to employees of employers who do not offer group health insurance, or if the insurance does not comply with provisions of the Affordable Care Act, such as meeting minimum requirements for employees' contribution, which is 9.5% of their annual household income. So in other words, if you as an employer are charging your employees more than 9.5% towards the cost of their insurance premium as related to their household income, they would be eligible to go to the exchange and get a premium subsidy. But if you are within those guidelines of less than 9.5% of the employees contributing to the insurance, the employee may go to the exchange, but they wouldn't be eligible for any subsidies. As a small employer and you're offering a group health insurance program to your employees, you can determine what level of employment qualifies for insurance. In other words, it's up to you to decide the number of hours required for an employee to be eligible to participate in your group health insurance program. So if you decide that someone that's working 20 hours a week is eligible to participate in your group insurance plan, they may. But by the law, anyone that's working 30 hours a week or more must be offered the insurance if you have a group plan in place.